Hello everyone, my name is Ron McCulloch and I am a consultant podiatric surgeon specializing in condition of Morton's neuroma. I've done a lot of videos discussing minimally invasive techniques, things like cryosurgery, radio frequency, and I also talk sometimes about open surgery and the fact that I do far fewer of these cases as a result of these tremendous technologies that have really transformed how we manage the condition. However, this image of a very large Morton's neuroma really demonstrates a scenario where only an open procedure is going to be successful. And the reason for that is the size of the neuroma. In this case, it was in excess of 2 centimeters of true fibrous tissue rather than simply fluid. And in those circumstances, realistically, I think it's a big ask to expect cryosurgery, even radiofrequency, to be successful. So the vast majority of our patients do respond to cryosurgery and radiofrequency, but when I see a lesion this large, I will sometimes recommend the patient go straight, or often recommend that the patient go straight to surgery, and that's what happened in this case. Now, the important take-home message, however, is this one. Often I have patients coming to my office saying that they've been diagnosed with a neuroma of maybe a centimeter and a half, even 2 centimeters, and remember this is width, not length. And they may therefore look at this video and think, oh, I'm not going to be suitable for a minimally invasive procedure like cryosurgery, but this is rarely the case. And the reason for that is fairly straightforward, in that the size of the neuroma is often exaggerated when reported on scans and MRI and ultrasound. And the reason for that is because often the neuroma is measured in combination with a degree of fluid around it, and that makes it look much larger than it truly is. There are specific specialized ultrasound techniques that I use which allows me to determine how much of it is true neuroma and how much of the pathology is partly fluid and bursitis and other things. And this is really critical because there are many times when patients have come into me and said, look, I've got a centimeter and a half neuroma, and I've said, well, I doubt that, and then I've done the scan, and in fact it's proven to be nothing near as large as that. And often neuromas that are reported in the area of 1.5 centimeters will compress down when assessed properly to around 5-6 millimeters. So please don't think that you're not necessarily going to be a candidate for minimally invasive surgery, but if you have a true large fibrous neuroma of the size in this image, then you may end up needing open surgery.